Thanks for joining us again today. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 951. That represents 9.6% of the total number of tests and takes the total number of confirmed cases in Scotland now to 66,012. 385 of the new cases were in Greater Glasgow and Clyde, 268 in Lanarkshire, 76 in Ayrshire and Arran and 69 in Lothian. The remaining cases were spread across the 7 other mainland health board areas. I can also confirm that 1,225 people are currently in hospital. That is an increase of 32 from yesterday, and 93 people are in intensive care, which is 12 more than yesterday. And finally, no deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. However, as you will recall, registration offices are largely closed on Sundays, and so that should be treated with some caution. I would sadly expect that number to rise again tomorrow. And of course, since the last briefing on Friday, 30 additional deaths have been registered, which means that the total number of deaths under the daily measurement is now 2,849. That total reminds us of the impact the virus has and is continuing to have, and I want again to pass on my condolences to all those who have lost loved ones. I'm joined today by the Health Secretary and the Chief Medical Officer. In a few moments, the Health Secretary will talk about care homes and also confirm some additional funding for community-based mental health services for young people. I have 2 issues I want to briefly cover today. In a moment, I'm going to reflect a little bit on implications for Scotland of the UK Government's announcement on Saturday of significant new restrictions for England from later this week. But before that, I want to remind everyone that in Scotland, the new system of levels came into force at 6 a.m. this morning. Now, for most people in most parts of Scotland, that does not lead to any immediate or major changes in the rules that were already in place. However, there are 2 points in particular that I think it is worth me noting right now. Highland, Moray, Orkney, Shetland and the Western Isles are now in level 1. That reflects the lower prevalence of the virus in these areas. However, for the moment, it continues to be the case that people in those areas, as is the case in all parts of the country, should not meet up in each other's homes. So, as I say, that remains the rule across the whole country, and that is an important precaution that is still in place at this time while the virus remains a significant threat. The other significant change relates to people in Dundee, which today becomes a level 3 area. Most parts of the Central Belt are also in level 3. That means tighter restrictions apply, including for hospitality premises. And it also means for people in Dundee, as for all level 3 areas, we're asking that you do not travel outside your local authority area unless you have an essential reason for doing so. Full detail of the rules that apply at each level are available on the Scottish Government's website, and from today the website now also has a postcode checker, so you can enter your postcode and see the rules that are applicable in your area. And that means if you're in any doubt at all about the do's and don'ts, please check on that postcode checker. I hope it will be helpful in enabling everyone to understand and to follow the new system. It is vital that everyone sticks to the rules. That's always been the case. But at this juncture, I really can't stress that enough. Please don't try to put your own twist on the rules or look for loopholes in them. It's really important right now that all of us try to keep within the spirit of these rules and remember what they are designed to do: drive down levels of this virus. So please remember that and act within the rules to reduce your social interactions as much as possible. Now, the second issue I want to touch on is the UK Government's announcement on Saturday of new measures coming into force in England from Thursday. I've just come from a COBRA meeting chaired by Michael Gove and attended by representatives of the other devolved administrations. The Scottish Government is, as you would expect, considering carefully any implications for Scotland of the announcements for England. And there is one issue that I want to air with you today. As you know, I've tried throughout the pandemic to be as open as possible about the difficult choices we face and the factors we have to weigh up in making those difficult choices. So today it's important to set out the kind of decision that we face over the coming days. Today, as I have mentioned, the new level system takes effect, and for many this sees the continuation of tough restrictions. When COVID cases started to surge again, we acted quickly, though we've been clear all along that our room for manoeuvre is limited by our lack of financial levers. Without borrowing powers of our own in the Scottish Government, we have to rely on the UK Government's financial interventions, and that is true of the other devolved administrations too. Notwithstanding that, in September we took the tough decision to restrict meetings in our own homes, and in early October we put restrictions on hospitality. Now, we think we can see some encouraging signs that these restrictions are having an impact. The rate of increase in cases has been slowing down, and I think you can see that in the numbers I'm reporting every day. However, and it's important to be equally clear about this, the impact is at this stage still quite gradual, and we can't yet be sure that it will be sustained or that it will go as far as we need it to go. The position, as it is in so many countries across the world, remains very fragile, and obviously we remain concerned about the rise in hospital and intensive care admissions. So it would be wrong to say that we have no concerns about the next few weeks. Clearly that would not be correct. We still face a lot of uncertainty, as all countries do. That's why I made clear last week, when I set out the levels that would apply initially, that we might yet have to go further, and that we can't rule out and shouldn't rule out a move to level 4 for all or parts of the country. And while that decision would never be easy, there is no doubt that the availability of a more extensive furlough scheme of the kind that the Prime Minister announced on Saturday would make it slightly less difficult, because workers would have more of their wages paid. So the decision we have to weigh up in coming days is this one: should we take the opportunity of more generous financial support to step harder on the brakes now to try to drive infection rates down faster and more firmly? The potential benefit of that would be suppressing the virus further and faster at a time when financial support is available, and possibly, I don't want to overstate this, but possibly opening up a bit more breathing space over the Christmas period. Now, ideally, we would assess the impact of the current restrictions for a bit longer before making that decision, and at the very least wait until our next scheduled review point, which is due next Tuesday, a week tomorrow. But here's the dilemma we face, and it's important that I'm open with you about it. At this stage, the indication is that the more generous furlough scheme is only going to be available for the next month during the period of England's lockdown. Now, we continue to press the case that it should be available to devolved administrations whenever it is needed, and I think most reasonable people would think that is the fair position, and I, with colleagues in the Welsh and Northern Irish governments, have pressed that point very firmly at the COBRA meeting, which has just concluded. But we can't put off vital decisions while we have a debate with the Treasury, because the virus doesn't stop spreading while we do that. That's why I hope we get absolute clarity on that point from the Treasury today, because it matters to our decision making here in Scotland. If we know furlough is available without limit of time, we might still ultimately have to act, but we could give ourselves a bit more time to assess the situation, and so not take decisions too quickly that would involve more restrictions on people before we've had the opportunity to assess the current situation. However, if the furlough extension remains time limited, we will face having to take that decision more quickly, because we'll be faced with the risk of not acting now, meaning that we might have to act later, but at a time when the financial support is not available. COVID, in my view, is complicated enough, and dealing with it is hard enough without these unnecessary additional complications. So I am hopeful that we will get some clarity with the Treasury, from the Treasury later on. That doesn't mean that we suddenly escape tough decisions, but that would mean we can continue to take those decisions in a proper, measured, timely way in Scotland, taking account of our own data. So I wanted to air that with you today. That's the decision we face and the situation we face over the next few days. I intend to speak to other party leaders later today. Of course, I will keep Parliament updated over the course of the week, and I will update all of you over the course of the week as well. Those are the issues I wanted to update on today. To close, though, let me remind everybody of the rules and guidelines that are in place now. As I said earlier on, it is so vital right now that all of us comply with these rules to the maximum. If you live in a level 3 area, as you know, that's most parts of the Central Belt, including Dundee now, you should not travel outside your own local authority area unless it is essential for work that can't be done at home, for example, or for caring responsibilities. And people in other parts of Scotland should not travel into level 3 areas except for the same essential purposes. And please, we're also asking people not to travel outside of Scotland unless it is essential to do so. Abiding by travel restrictions is essential if a regional approach is to be sustainable now and into the future, because we must guard against taking the virus from high prevalence areas to low prevalence areas. Secondly, none of us anywhere in Scotland should be visiting each other's homes right now, again, except for very specific purposes, childcare or caring for an older or vulnerable person. When we do meet people from other households outdoors or in indoor public places, the maximum group size is 6 from a maximum of 2 households. Please avoid car sharing unless it's essential. Work from home if you can, and remember to download Protect Scotland app if you haven't already done so. And finally, remember the 5 key rules that help keep us all safe wherever we are. Wear face coverings, avoid places with crowds of people, clean your hands regularly, and remember to clean hard surfaces as well. Keep 2 metres distance from people in other households, and self-isolate and get tested immediately if you have the symptoms of COVID. These rules are about protecting ourselves, they are about protecting those we love, our wider communities, and they are also about protecting the National Health Service and ultimately saving lives. So my thanks to everybody for your compliance. Please, please stick with it. I'll now hand over to the Health Secretary to cover a couple of points before I and the Chief Medical Officer take questions.
Thank you very much, First Minister. It is true that this pandemic has affected the mental health and well-being of people across Scotland. In different ways, it has affected all of us, regardless of our age. But for children and young people, the impact has been particularly acute. From the isolation of lockdown, missing your friends and worrying about school lessons, to the stresses of restarting school and the necessary limitations on the daily life and that of your family. Children and young people have had a great deal to deal with, uncertainty and anxiety alongside that. Sadly, we know that this has exacerbated the mental health struggles for many young people and has also created new struggles for many more. For that reason, we're determined to improve and expand mental health support for children and young people across the country. This has already been a priority for this government before the pandemic, but the need for action is great now. So today I'm announcing £50 million of funding to respond to children and young people's mental health issues, with a focus on those exacerbated or surfacing from the COVID pandemic. The money will be distributed to local authorities to support a local response for those aged 5 to 24, their families and their carers. Of that 15 million, just over 11 is for services in response to the pandemic, such as support for children who are struggling emotionally due to returning to school under new restrictions or for other reasons. The remaining just under 4 million is the first instalment of what will be an annual £15 million fund to provide new and enhanced community mental health and wellbeing services with a focus on prevention, early intervention and the treatment of distress. Local authorities will make decisions on how the money is used based on their knowledge and understanding of local need and circumstance. The decisions will be theirs, but they could, for example, use this fund to extend counselling services in schools or to expand local advice helplines. Of course, and I do want to emphasise this point, there is already support available for children and young people should they need it. Scott's I Feel resource is a really good starting point. It has some useful advice and information on protecting mental health and well-being, and it sets out how you can get additional support. So if you do need help, you can find it by searching online for Young Scott I Feel. This has been a really tough period for all of us, and it continues to be tough. And it is okay not to feel okay. But it is important that all of us, particularly children and young people, that you know you're not alone. We'll help you and we'll help each other, and together we will get through this. Finally, before I conclude, just a short word about what will be published tomorrow. Tomorrow I will publish our first adult social care winter preparedness plan, the first ever, brought together through work with a range of our partners, and we will also introduce a new web page for care home relatives, something they have asked for. Details of both will be available tomorrow when I make a statement in Parliament in the afternoon, and we will make sure through social media and our other channels that you'll be able to access both the winter plan and the web page and the evidence paper that supports. Thank you.
Thanks, Jeane. I'll go straight to questions now. Firstly, Glenn Campbell from the BBC.
Thank you, First Minister. I have a question for you and one for the Health Secretary. To the Health Secretary, given the projections in England that hospitals could exceed capacity before Christmas, do you have models for Scotland that give you confidence this is not going to happen here? And is that why staff are on standby at the Louisa Jordan to take patients in the near future? And to you, First Minister, on the issue of furlough, do you think that people in Scotland would accept something closer to a lockdown that might not be necessary just because you can't be sure the money would be there to support a lockdown if it was required at a later stage?
I think it's, and forgive me if what I'm about to say sounds quite complicated, because this situation is, as all of us have come to know, complicated. I wouldn't be taking decisions that I thought and were certain were not necessary, because I don't think that would be acceptable. The question is because the situation we've got right now, as I tried to set out, is we think we're seeing progress, but we can't be sure that that progress is going to be sustained or it is going to go far and fast enough. So if there is a doubt in our minds and we have the certainty of greater financial support now, but don't have that certainty later on, would that tip the balance towards acting sooner rather than later? We may have to act later, earlier. So it's about whether the balance tips. It would be better if we had the certainty of the financial support whenever we needed it, and then we could continue the course we are on right now, which is assessing the situation on a daily basis, trying to build more confidence in our direction of travel, monitoring all aspects of the data. And that's the position I hope we can continue to be in. But I also think people in Scotland would not take kindly to a situation which would not be of the Scottish Government's making, where in a month from now we have to act more firmly and we don't at that stage have the financial support. Whereas if we'd acted earlier, we could have perhaps got the same benefit, but at a time when that support is available. So these are difficult judgments, and we will take them carefully with all of these things in mind. I'll hand over to the Health Secretary on hospital capacity. All I will say in response to that is that we monitor projections for hospital capacity on a daily basis, and we'll be doing this week, as we do every week, projections looking at things based on our current data to give us the best line of sight as to the ability of our hospitals generally and intensive care units to cope. And that is always a factor in our wider decision making.
On furlough, what is your message to Boris Johnson as he puts the finishing touches to his
give
speech
us,
to Parliament? Just
give us the certainty that the situation that has now been guaranteed for England, that there is a lockdown in England and therefore there will be extended furlough, that same guarantee applies to all other parts of the UK if we need to take the same action at any time. It doesn't seem right to me, and I'm trying not to be political about this pandemic generally, but it can't be right. And this would apply to Manchester in the last few weeks, just as it would apply to Scotland and Wales and Northern Ireland. It can't be right that the only time that additional financial support is made available is when the south of England needs to go into a lockdown. That just isn't fair, given the situation that we're dealing with just now. So, just take that uncertainty away and say that the more generous furlough will be available for any part of the UK whenever it is needed, not just there when England has to be in lockdown, regardless of the situation elsewhere in the UK. Jeane.
Thanks, First Minister. So as the First Minister said, we do model our anticipated demand from COVID cases, both in hospital beds and in ICU. But we model that now alongside what we do every year, which is model the anticipated demand coming simply from winter itself. So right now, the two are coming together to give us an indication of how we expect to be able to respond. I set some of that out last week in the statement to Parliament. And we take steps to ensure that whereas for now, the particular demand is concentrated in different parts of the country, that our NHS boards have a national system of mutual aid where they can, where a board that is less pressed in that regard can step in and assist a colleague board, a neighbour board, to continue to provide, for example, some level of non-COVID care to make sure that patients can still have access to that, because we are trying very hard not only to be able to respond appropriately and quickly to COVID demand, but also to maintain other non-COVID health services. And that's where Louisa Jordan comes in. Louisa Jordan is ready to stand up to respond to COVID in 1 week. But at the moment, it is assisting us greatly by providing a number of non-COVID services covering diagnostics, orthopaedics, dermatology, and so on. So all of that work is underway on a constant basis. And we, at my level, at First Minister, look at this all the time to make sure that we have everything in place that we need. The other important point to make before I finish is that we already have in Scotland, in hospitals across the country, and with our National Procurement Service in their storage facilities, all of the ventilators and associated supply that we need to quadruple our current capacity on ventilators.
Just a bit of context in terms of the numbers we've reported today and how they compare with earlier in the year. We've reported today 93 patients in intensive care. Back in the spring, at the peak, the highest number in intensive care at any one time was about 150. So we're still a bit off that, but obviously rising. On hospital admissions more generally, today just over 1,200 patients in hospital. At the peak back in the spring, that was around 1,500. So we're not very far off getting close to that peak in terms of hospital admissions. And these are figures that we look at very, very carefully and are a key part. They are lag indicators because of the life cycle of the virus, but they are figures that we look at very carefully as we make our wider judgments about the steps we have to take. Alison McCallum from STV.
Thank you. Good afternoon. For you, First Minister, first of all, for clarity, can businesses that have either been restricted or had to close across the country, regardless of what level their local authority area in, can they apply for the furlough scheme right now? And have you been shown or heard anything that gives you any hope that there will be an extension beyond the English lockdown or that flexibility in furlough that you're looking for?
So on the answer to your first question, yes. As of now, for the month that the Chancellor has said furlough is going to be extended, it has been extended across the UK. So businesses who are eligible in Scotland can apply for it now. The question that is unresolved is how long is that going to last? Businesses that are eligible now will benefit from that, but the point is, if after the end of this month, Scotland had to take further restrictions that meant more businesses were having to rely on furlough, would that more generous provision be available then? And that's the question that we are seeking to get clarity on. Look, I can only work on what we've been told so far, which is that it comes to an end at the end of England's lockdown, which will be, as far as we know right now, the 2nd of December. I pressed the point at Cobra, the Welsh and Northern Irish governments pressed it as well. And the answer was that the Treasury is listening and will be reflecting on the points we've made. I don't know, to be perfectly honest, whether I should take that positively or in the sense that there is a genuine reconsideration, or whether it was just warm words in the course of a meeting. I'm hoping for the former, but I have to plan on the basis of what I have certainty over. And at the moment, all I have in terms of an indication is that it is going to be time limited. So, we don't have too much time where we can wait for the Treasury to change its mind before we have to make plans on the basis of that assumption. So today, tomorrow, I think is when we need to see change from the Treasury, if that change is going to come. If it doesn't, then we're going to have to plan on the basis that it is a very time-limited furlough extension, which would have implications for our decision-making. And it's not about, just to go back to Glenn's point and try to articulate this as clearly as I can, it's not about taking actions that we think are not necessary. It's about being in a position now where we can't rule out these actions being necessary at some stage. So the judgment becomes, do we take them while the financial support is there, or do we delay them to a point where the financial support might not be there? That's the decision that becomes quite difficult for us if we are faced with a very time-limited extension. Peter McMahon from ITV Borders.
Thank you very much, First Minister. First Minister, it's clear from looking at the statistics that the number of cases per 100,000 south of the border in Cumbria and Northumberland is definitely higher than it is immediately north of the border in Scotland. But that, from your own figures, is equally true to areas north of Dumfries and Galloway and the Scottish borders, in Tier 3 areas like Lanarkshire and the Lothians. So, in your judgment, what is the highest risk for people in the south of Scotland? Is it people travelling within Scotland or between England and Scotland? And if there is that risk, and obviously they want to try and get to level 1 if they can, and there was some hope for that last week, how will you apply, how will you try and help them get there? Does it mean policing travel within Scotland or between Scotland and England? And does it mean actually statutorily policing that as opposed to just issuing guidance and advice?
It could mean that if we think that is necessary, and I've never ruled that out, and it remains under active consideration. The point I've equally made is that the police cannot check everybody's journey. So whether it's guidance or regulation, ultimately we need people to abide if it's going to work. In terms of if you take Dumfries and Galloway, the borders where prevalence is lower, what are the risks to that position? The risk, first and foremost, would be people in those areas not abiding by the rules and allowing the virus opportunities to spread, and that is the same for those areas as it is for every part of the country. So my key message is, if you live in any part of Scotland, but we're talking about Dumfries and Galloway, the borders at the moment, is make sure you are abiding by the rules that apply in your area. There is then always a risk when you have a differentiated approach between different parts of a country, which the benefit of which is that it's more targeted and proportionate. But the downside is if people then travel in and out of different areas, they risk taking the virus from higher prevalence areas to lower prevalence areas, and the lower prevalence areas don't stay low prevalence for very long. So it is absolutely essential that people do not travel from level 3 areas into level 2 or level 1 areas, and people within the lower level areas, Dumfries and Galloway, the borders, don't travel into higher level areas because they risk then getting the virus and taking it back home with them. And that applies across the England-Scotland border as well. We know there are higher prevalence areas just south of the border, and therefore don't travel in or out if at all possible. That's how we try to stop importation and spread of the virus. It's not easy, but it is really, really essential. And this is a factor in our decision making. Yes, we all want to see every part of Scotland go down a level if possible, although there's a lot of uncertainty in our figures just now that I've already been speaking about. But clearly, and I know the Welsh First Minister, who's probably speaking at the same time as me just now, is worried about this in terms of when they come out of their fire break, as they call it, next week, but English pubs are closed completely. Does that lead to a risk of people going across the border into Wales to have a pint. So clearly, we have to have regard to these issues as well. That if taking an area around the border down a level, does that open up more risk that people from other areas will take the risk and travel in? None of these are easy decisions to reach, but I can't emphasise enough the importance of abiding by travel restrictions if a differentiated approach is going to be sustainable over the medium to long term. Jack Foster from Global.
Good afternoon, First Minister. I appreciate this isn't entirely disconnected from the concerns you've raised about financial support, but back in the first lockdown earlier in the year, you repeatedly said that you favoured a four nations approach where we all moved at the pace of the slowest part of the UK. And given that England and Wales are currently in lockdowns, albeit on different timetables, and Scotland is not, what has changed since the spring in terms of the benefits of moving at the pace of the slowest of the four nations?
So it's a good question. I guess back when I said that, we were all at the same level, and the question then was, did we keep moving at the same level or start to vary? And I'm not making any judgments about this. England started to move more quickly out of lockdown, and we took a decision to do that more slowly. So fast forward 6 months and we're all at different points, and that's not as easy an equation to make. And we took much more, to impose tougher restrictions earlier. If we are talking the last couple of months, household restrictions, hospitality restrictions have been in place in Scotland since September. In fact, for some parts of Scotland, longer than that. So we've actually taken a tougher approach. I still think, though, all of that said, that we cannot be completely blind to what's happening across our border. We can't be blind to what's happening in other parts of the UK. At the very least, we've got to try to have consistent messages. But because of the varied approaches we have taken over the past few months, we have different levels of prevalence of the virus, and therefore it is important that we continue to try as far as possible to take decisions based on the circumstances each of us are facing. I make no criticism of the decisions that are being taken in the other three nations. All leaders have to take the decisions that they think are right, and that's what I'm trying to do. This complication at the moment of perhaps being forced into a position of taking some decisions a bit more quickly than we would otherwise want to do because of a financial consideration is one that I would rather not be in. But again, I've got to deal with the reality of the situation we face. Do you want to say anything about varied?
So across the UK just now, what we're seeing, particularly across the four nations, is quite a variation just now in the case numbers per 100,000. If you take the Scottish figures just now, we probably over the last 7 days reflect a figure of about 170 cases per 100,000 across Scotland. And of course there's some variation even within Scotland in that way as well. But if you look at the other nations at this moment in time, England, Wales and Northern Ireland are all showing higher levels of cases per 100,000, up to I think a high of probably about 350 cases per 100,000 in Northern Ireland just now. This geographical variation that we're seeing just now shows that the epidemic curve is in slightly different places in different parts of the country, and there's all sorts of reasons for that, and some of that is about the level of cases we had when we started to ease some of the measures that were in place and the rapidity with which we've applied some of those measures back into place as well. We've seen some encouraging signs in Scotland that the case rate is certainly falling, but what we're charting very closely just now is the rate at which that is falling and whether we're seeing a continual decline or whether that's starting to plateau. And over the coming days, we will continue to measure that to make sure that we're starting to see that. The growth rate at the moment is probably around about 3%, and that means that R is still above 1. As long as R is still above 1, we are still going to see growth in cases across the country. That's increased cases and the potential for increased hospital admissions and deaths in the future. So what we still want to see as our goal is to get R as close to below 1 as possible.
Neil Pooran from PA.
Thanks, First Minister. You mentioned how the extension of the furlough scheme to December has sort of changed the landscape in which you can make decisions. I was wondering if you would, if you're going to be revisiting the decisions you made around which local authority goes into which level in light of this, and In particular, NHS Lanarkshire, I know at the time you mentioned it was quite a borderline decision between level 3 and 4 for Lanarkshire, North and South Lanarkshire, I should say. And is the earliest possible time you would review this at the date next week, or could you potentially move faster than that?
So that's really what I was trying to set out in my initial remarks. Ideally, we would review it at the next review point, which is a week tomorrow, and I would set that out in Parliament. And in theory, Neil, you know, and I am talking in theory here, having greater financial support does potentially, not necessarily, tip the balance of borderline decisions between level 3 and level 4. If we have the certainty of greater financial support, then possibly deciding to, you know, step on the brakes a bit harder is an option for us. But we want to continue to take these decisions in line with our own considerations and the monitoring of the data that we're doing. And that would mean that the next time we reviewed the levels and came to these conclusions would be next Tuesday. The complicating factor here is that if the clarity that comes from the Treasury is that this extended furlough is only available for a month, then clearly we don't have much time to waste. If we then are taking decisions next Tuesday, which would be for implementation the following Friday, we're already kind of halfway into that month. So if that is the unchanged position of the Treasury, the point I'm making today is that it possibly accelerates our decision making this week. I'd rather not be in that position, but that's the reality that we would face. And again, to repeat the point I made earlier on, this is not about accelerating a decision on restrictions that we don't think are necessary. It's about not being able to rule out that they are necessary in the future, so potentially deciding to take the decisions when financial support is available rather than delay them to a point that financial support might not be available. I wish that wasn't the basis for decision making, and that's why I hope the Treasury will give us clarity today that the furlough extension is not time limited, because that then means that we continue to take decisions on the proper basis. But I have to deal with the reality of the situation I face, and that means not delaying decisions beyond what is sensible. Chris Musson from The Sun.
Hi, First Minister. On this furlough issue and the logic of your decision making, just to check, why does the new availability of furlough at 80% alter your calculations on moving areas to level 4? Because we were told last week this was an objective process based on 5 indicators. 80% furlough availability was not one of the indicators or ever built in to your calculations as far as I'm aware. So why not stick to your guns with your current system? And secondly, Professor Linda Ball spoke yesterday about how confidence in government's handling of the pandemic could be dented if you switch too quickly from the levels system, which obviously only kicked in today, and how that in turn could reduce compliance with rules. So how much of a worry is this?
Just so everyone's a doubt, I'm not suggesting that we move away from the levels system. It's about the decisions we make about how that level system is applied at what levels in different parts of the country. I'm acutely aware every single day of needing to strive to take the best decisions, the most rational decisions that we can, and to communicate them and to have confidence in those. That's possibly the most important part of everything that we're doing right now, because if people don't have confidence, then compliance will be lower. In terms of the first part of your question, what we do, and this is set out in the paper, the technical paper we published last week, we have the clinical indicators that we judge, and those are cases per 100,000, projections for cases per 100,000, test positivity, and actual and projected hospital capacity. And as I said last week, it's not an automatic algorithm. We apply judgment to that. But what we then do is what we call the 4 harms assessment of all of that, which is where we balance that with the economic harm and the social harm and the wider health harms that measures. So the wider economic and financial impact is a part of that overall consideration. I am not saying that the provision of 80% as opposed to lower furlough is the only factor at play here. What I am saying is that it is not an insignificant factor when we do that wider economic for harms assessment, and it could have an impact if we're taking, balanced decisions on, one indicator may take us that way, but the economic harm means we come down on the other side of that balance. It could have a factor there. So it's not unimportant, but that broader assessment, of course, continues to be important as well. Simon Johnson from The Telegraph.
Just on the issue to do with confidence, First Minister, and Linda Ball's comments yesterday that changing a system too quickly could dent confidence and dent compliance. I
answered that question. I said I'm acutely aware of the need to maintain confidence in, and that's a key part of my consideration every day. And one of the really difficult balances, literally, governments have to strike every day here is between, trying to get a level of sustainability and consistency in what we're saying, but also having the flexibility to respond to an infectious virus, and that constantly is demanding judgments that have the ability to maintain public confidence absolutely at their core. So I agree with Linda's points, but as I'm sure she would say, that doesn't make the decisions any easier. We have to continue to balance all of these different factors. Simon Johnson.
Good afternoon, First Minister. I think you basically just answered this, but just for absolute clarity, by stepping on the brakes, you are not talking about abandoning the regional approach and imposing a national lockdown during the next month to take account of furlough, but maintaining the 5-tier approach, maybe areas going from 3 to 4, from 2 to 3. I just wanted to get clarity on that. And secondly, Michael Gove was on the Sophie Ridge programme yesterday, and he expressed confidence that the national lockdown in England will bring the R number below 1 by the time it finishes on December the 2nd. I just wondered what the modelling in Scotland is showing for the 5-tier system of when the R number will fall below 1. Thank you.
I wouldn't put a date on that. One of the things, put aside developments in England over the weekend, one of the factors in our consideration is, we are seeing a levelling off in the increase of cases. It is possible now, although I don't want to overstate this because we need a couple of days more data, that we've tipped into a bit of a decline in cases. The big question is, will that continue? Is that sustainable, and is it going to continue, and is it going to go far enough to comfortably get the R number below 1? And that is what we are monitoring all of the time, and that will be a factor in the future decisions that we take, regardless of the issues on furlough. The point I'm making about furlough is it does have a factor or have an impact on how quickly we might feel that we need to take those decisions, but we need to continue to monitor that very, very carefully. Gregor might want to say a bit more about that. So we have the 5 levels framework. Now, we haven't taken decisions, and hopefully we will take them in line with the next review point and not have to take them more quickly than this. But, that could involve, and I said this last week, and I am talking illustratively here, don't take this as a steer of where we're going, but what the framework allows you to do is, if necessary, apply a single level across the whole country. So you could, in theory, have level 4 across the whole country, or you could have level 4 in the central belt and other parts of the country at a lower level, which I think if we can, if the evidence supports that, is what we would want to do, because it is more proportionate and more targeted. But the advantage of the level system is it gives you that flexibility to respond nationally if necessary, but locally and regionally if that is possible.
Thanks, First Minister. Simon, thanks for your question. Just to recap on where we are with R, you'll recall that our modelling and analyst teams make a calculation of R on a weekly basis in Scotland, and those calculations are quite complex and take some time, but they're then subjected to peer review through the SAGE process, and we announce those generally towards the kind of mid to the end of the week each time. Now, what we have seen with that process over recent weeks is that R is reducing in Scotland, and the last calculation of R shows that it now has an estimated level of between 1 and 1.3. Now that still sits clearly above 1, and therefore we are still seeing growth within that. It's based on lag data, of course, that feed into that calculation process. So what we will see towards the middle of this week is what is the latest calculation of R, and perhaps at that point in time we'll start to see really some of the impact of the stronger measures that were put in place and what impact that has on the growth across the country. Meantime, as well as calculating R and as well as calculating that growth rate, we continually use the daily 7-day rolling average for the case rate to give us a sense of where the kind of the current data is tracking. And as I say, some encouraging signs with that. And what we would want to make sure is that decrease in the overall case rate per 100,000 is continuing over time rather than perhaps starting to show a plateau. I'm encouraged by what I see just now, but want to track that for days to come.
Michael Blackley from the Daily Mail.
Thank you. Good afternoon. I think some people in low prevalence areas that are watching this today might be a little bit confused about what may or may not lie ahead for them. So just to be clear, if you don't get an assurance from the Treasury today that furlough will be available whenever required, is it possible that some of these level 1 areas might face full closure of hospitality, for example? And how soon will that be? Will we hear a decision on this tomorrow?
We'll monitor this over the course of the week. Ideally, we want to stick within our own review timetable, but I cannot ignore the availability of financial support. I wish I wasn't in a position where that seemed to be only on offer for a limited period of time. We haven't reached decisions, and I will stand here day in and day out and update people as we go. I'm not going to speculate what those decisions might be before we have taken them. I'm airing, as I've always tried to do, some of the factors that we are weighing up. For now, my advice to people in all parts of the country is abide by the rules applicable in your part of the country, because that's the best way that we continue to bear down on the virus and hopefully keep our own data going in the right direction. Scott McNabb from the Scotsman.
Thank you, First Minister. Just to be clear, it seems to me you're suggesting Scotland may be bounced into a national approach to these restrictions, not on the basis of the data available to you, but this financial aspect, but really the situation down in England. Is that the case? And I know you're talking about representations to the Treasury, but I'm wondering if you're getting any other indications that the furlough scheme may only be open till the end of December to correlate with the English situation. And could I ask the Chief Medical Officer, given you've just said there were encouraging signs that the rate is falling and you're encouraged by the numbers that you're seeing, would your advice at the moment to the First Minister be that a national approach to lockdown is necessary based on data and prevalence of the virus?
In terms of other indications, as I said, I've just come from a COBRA meeting. I hope that the signals there were positive, but I don't know whether that would be overly optimistic. It was quite hard to be certain. And just to be clear, as things stand at the moment, the extension to furlough lasts until the end of November or the beginning of December, not the end of December. Just to be clear what I'm saying here, and I know this is really complicated, the situation here is that I cannot be sure, nobody can be sure, that a few weeks from now we don't have to take tougher steps to get this virus under control. So if I can't rule that out, the question becomes, if furlough is time limited, do we take these decisions now while the financial support is available, or do we risk leaving them a bit longer and having to take them potentially when financial support is not available? And that's the situation, that if this time limited furlough scheme doesn't change, we are kind of forced into. I wouldn't necessarily use the language that you've used. And that doesn't necessarily mean the whole country going into level 4, but it might mean that we take steps to just apply the brakes a bit harder while financial support is available, whereas if we didn't have that pressure, we could continue to monitor it for a bit longer. But I'm setting this out today because I like to air these things to try and build as much of an understanding of what we're grappling with. We haven't taken final decisions, and hopefully the kind of time pressure that I'm talking about here today might be removed if we get a bit of clarity from the Treasury that the furlough extension is not strictly time limited and would be available for devolved administrations when and if they need it. Gregor.
Thanks, Scott. So I think what we're seeing just now is variation across the country in terms of the current prevalence of the disease, and of course that is why we've described the levels-based approach just now. I am encouraged by a lot of the signals that we're getting from the data just now, and as I say, we need to track that very, very closely. And over the coming days, as I say, one of the most important aspects of that is as we see this gradually reducing level of case rate per 100,000 over the last 7 days, is whether that decline is both fast enough and is sustainable. Because if we begin to see that slow down and we begin to plateau with a case rate that is still relatively high, then my concern would be is that over the winter, and particularly as we get deeper and deeper into winter, if we start to see an increase in the number of cases and the spread of the infection again, where, if you like, that increase is starting from a much higher point of where there's many more disease, people with the disease across our communities as well, that signals that any kind of jump off from that higher level might actually accelerate much more quickly than we've experienced at this point. So I'm going to want to see over the coming days continued signs that the case rate continues to fall, and I would like to see that case rate falling just a little bit more quickly than we're seeing just now.
I think that's an important point, just to stress. Put aside developments in the UK and this issue with furlough. All that potentially does is tip the balance on the timing of some of these decisions for the Scottish Government. That aside, though, what we have to look at right now is not just are the increase in cases levelling off, or is it starting to decline? It's also the rate at which it is declining. Is it going down fast enough to give us confidence as we go into the winter that we don't suddenly see it take off again and it would quickly overwhelm us? So the speed and rate of that improvement is important and is something we look very carefully at. And if our judgment is that it's not happening far and fast enough, that could then lead us to say, well, we just have to do a little bit more to try to accelerate that to get us into a safer position over the winter period. Mark McLaughlin from The Times.
Good afternoon. This might be one for the Chief Medical Officer. I'm just looking at your modelling the pandemic report from the 22nd of October. I think that's the most recent one. And it's projecting that on the trajectory you were on, you were looking at between about 50 and 90 deaths per day by the 10th, so by next week, basically. Now, we know that even without the tiered system, that appears to have slowed. So do you know what trajectory we were on just before the tiered system and what the trajectory will be under the tier system in terms of deaths per day? And I just want to clear something up about the Spanish strain of the virus. There's been a bit of either mischief or deliberate misunderstanding about what that means. I think I understand the Spanish strain. You don't have to go to Spain to get the Spanish strain of the virus. Is that right?
I'm hoping the Chief Medical Officer knows the answer to the question about the Spanish strain. My advice is don't go to Spain just now unless it is absolutely essential. Don't travel unless it is essential, but that's not simply to do with the Spanish strain. I'll hand over to Gregor on both those points. All I would say on deaths is, any death is one too many, but there were days last week when we announced more than 30 deaths in a single day. Today's figure I wouldn't put too much store on, given the weekend effect with registration offices being closed. So, the levels of deaths are not what any of us should be comfortable with right now. They are, to use perhaps insensitive sounding language, they are a lag effect, but nevertheless, we should never be comfortable about a level of deaths anywhere near the kind of one that you spoke about.
Thanks, Mark. So In terms of the kind of modelling just now, we don't yet have the model projections of how the levels will affect deaths over the coming weeks, and those will come as we begin to develop more data about the impact that those levels have had on the case rate, and gradually everything will follow through after that. So you can expect that we will be able to see more of that in coming days and weeks. I suspect. In terms of the Spanish strain, what we see across Europe just now is a number of different, if you like, viral families which are more evident, and some have been able to become much more predominant than others. They've originated from countries like Spain, who perhaps have had a high amount of international travel in and out of the country, and therefore it's taken the predominant strains there to other areas of particularly Europe as well. There's no evidence at this point in time that there's a huge distinction between any of these strains, that any in particular are becoming much more virulent, or that any are becoming associated with a much greater morbidity or mortality as well. We continue to track that. We have, through our whole genomic sequencing projects in Scotland, a sense of the number of different variants that we see across Scotland just now, many of whom have come from travel of one sort or another, either domestically in the UK or from international travel. But at this moment in time, I don't think it's helpful to concentrate solely on any one particular strain or viral lineage at all, because we know that no matter where these viruses come from, they're going to have a potential profound impact on individuals.
Thanks. Paul Mallock from the Courier.
Good afternoon, First Minister. Will test and trace details be monitored at all to see if people are travelling to different local authority areas? And with that in mind, would businesses be expected to hand over any information that would suggest that maybe someone's come from a Tier 3 area to a Tier 2 area to the relevant authorities, and would they subsequently be prosecuted for allowing a booking to take place in the first place?
I'm not sure what you mean about handing over information. We're not asking businesses to hand over information, but Test and Protect, yes, does give us information on where people have been if they test positive. It doesn't mean, and we've gone through this before, it doesn't mean that is proves where they got the virus, but we get information from Test and Protect that will say whether a positive case has travelled to other parts of the UK or travelled internationally, and whether they've been in hospitality or where else they might have been. So that information is available and will allow us to get a sense of whether there is travel implications for the spread of the virus. So yes, that is available. Don't know if you want to add, either of you?
The one thing I just add to that, First Minister, is that is important information, because it allows us to develop what's been talked about before, which is, if you like, themes and associations. So that helps us understand where transmission may be at higher levels in one theme, be it hospitality, compared to another. But that information that we gather is not identifiable in terms of how it's held to particular individuals, and it is not passed on to other authorities.
And lastly, Tom Gordon from the Herald.
Hello, First Minister. Can you tell us whether Mr. Gove gave the devolved nations any kind of encouragement to move to national lockdown and align with England over November? And I know you said you wouldn't necessarily have a national lockdown in Scotland and move Tier 1 to Tier 4 areas, but if you were to take this precautionary measure because the financial assistance was there to help, isn't the logic to really go for it, not hang back and just have a uniform system to try and purge the virus as best you can?
That's a decision we will take in the fullness of time. That makes it sound longer than it will be, but we'll take that with a proper consideration. You can certainly make that argument, but there would be other arguments about variation of prevalence of the virus. In terms of the first part of your question, no. I think there is a general understanding and respect across the four nations that we take our own decisions, and that we understand and try to respect each other's decisions. So I wouldn't say there was any general encouragement for the other nations to follow suit. In England, I think there is a Four Nations desire. Even if we have different restrictions in place at different times, we try to have, as aligned a message as possible, encouraging people to abide by restrictions. And there's definitely a strong view on the part of Wales, Scotland, and I think it was echoed today by the UK government, that we have to align our messages on travel, intra-UK travel. So that is certainly the case, but I wouldn't say there was any particular encouragement for us to follow suit or not, more a recognition that we have to arrive at these decisions ourselves. Okay, thank you very much indeed to the journalists for joining us today. Thanks to Jill for our interpretation, and to Jeane and Gregor for helping with the questions. I know things can sound a bit complicated when we've got factors that don't seem as if they should be driving decisions, and that is really the category that furlough falls into. I hope we get some clarity on that. But regardless of that, we continue to monitor levels of the virus every day, and we continue to try to come to the best decisions that are about making sure we get it under control and keep it under control. The way all of you can help in that right now is to abide by the restrictions that are in place in your own areas. Go on to the Scottish Government postcode checker, make sure you know the restrictions in your area and make sure you abide by them. And remember, nationwide, we're still asking people not to go into other people's houses. That is one of the key measures to try to reduce transmission. And remember, if you're in a level 3 area, don't travel outside your local authority area unless it's essential, and people across the country should not travel into level 3 areas. And remember the facts advice. Remember to wear your face coverings, stay away from crowded places, clean your hands and surfaces, keep 2 metres distance, and self-isolate and get tested if you have any of the symptoms. Thanks for joining us today. I'll be back here tomorrow at 12:15 to give you an update then. In the meantime, thanks very much.